Good evening, all.
Good evening. So I'd like to acknowledge the Indigenous population of Australia and acknowledge their elders for past, present and emerging. I think Tom knows a little bit more than me about that type of topic. And you don't have to listen to me this week, which is excellent. You've got the excellent Tom, who's a lot more experienced in teaching than I am. Have a good night.
Okay, good evening, everybody. We'll run through a series of slides first of all, then we'll get to questions and finish at the end. And if you can bear with me later on, I've got another PowerPoint to show from a marine biologist who has some different ideas on how to treat stings from jellyfish and uricungi and the likes thereof. And this is, here we go. So tonight we'll cover a range of topics, obviously land bugs, ticks, mosquitoes, bees, wasps, ants, march flies, spiders, leeches, and quite obviously our snakes, the red-bellied black, eastern brown, copperhead sea snakes. And the last comment there on the slide is basically the same, say that if you're ever overseas, find out what the local varieties are. Certainly when it comes to oceanic, with jellyfish, blue-ringed octopus, stonefish, and jellyfish again, cone shell. So quick rolling right in. That shot there shows how a tick can operate. The picture on the left is showing a tick that's burrowed well and truly into the skin. And the picture on the right shows an attempt to remove the tick's body with a pair of tweezers. It's not recommended to do that because if you agitate a tick to any degree, it may just start pumping more saliva into the victim. The simple method of getting rid of a tick we'll show you shortly. The reason I've got a few slides on ticks, a particular reason why, is because it tends not to get mentioned too much in first aid courses, but it can be quite a nasty little animal. Some of the symptoms of a paralysis tick includes rash, headache, fever, unsteady gait, unable to tolerate bright lights, weak limbs and a paralysed face. If you find someone has got a tick attached to them, have a look at the area first. Tick, have a look out for larvae and nymph, because they can be very small in the early stages. In fact, down to almost just a little black dot. But unless you're allergic, no need to see a doctor, but you can remove the tick itself. But then keep an eye on a patient for later injuries or illnesses. If they're allergic, even get them off to a doctor to have it removed properly. But if we go down to the bottom, if people start to develop serious allergic reaction, and particularly can have a reaction to meat and gelatin, products containing gelatin after a tick bite. And if that's the case, they need to be referred on to specialists. If you're not allergic, try to remove, do not try to squeeze or agitate the tick. And that can cause further problems. Now, up the top, first paragraph, we shouldn't have in our first aid kits, particularly in areas where you may get lots of ticks, is a ward-off freeze, Aerostat or Elastoplast cold spray. Spray that on, and after about 5 minutes, they should disappear. But if you try and use tweezers, the risk is that you'll leave the head in and only remove the body. But certainly don't use any metho, puro, petroleum jelly, nail polish, alcohol. or don't try and burn it off, because if you agitate the tick too much, it just creates further problems. If you can't remove it properly, leave it part of it in the skin, immediately you go to see a doctor. Signs of an infection can be increasing pain, swelling and redness, with red streaks leading from the area, pus or fever. The tick itself can sometimes cause other illnesses, rickets, Queensland tick typhus, Flinders Island spotted fever, and possibly Lyme disease, or Lyme disease conditions. And whether these are truly linked to tick-borne illnesses is still under investigation, but it's worth keeping an eye on a patient that's, particularly if you find more than one tick attached to their body. Is anybody, no, they're all muted, so yeah. If you've had a tick bite and you experience any of the symptoms, so flu, rash, pain in your joints or tiredness, see a doctor. Coming on to the next round of topics, and that's the old spiders. The life-threatening ones, of course, is the redback daddy longlegs. Well, the unlikelies, I mean, there is a redback, the daddy longlegs, a house spider. The two that we need to worry about, particularly in terms of fatalities, is the Sydney funnel web or the mouse spider. But the other one to keep an eye on is the white-tailed spider, which can cause flesh exposure. There's our little darling, the redback. Symptoms are sweating, muscular weakness, loss of coordination, nausea, vomiting, and in serious cases, convulsion. So basic first aid is an ice pack and certainly not the pressure immobilisation technique. The two darlings that we need to worry about in particular is quite obviously the female and male funnel web on the left and the mouse spider on the right hand side. And the mouse spider doesn't necessarily always have such a bright red head on its body, but as with the funnel web, they can be fatal. So quite honestly, if you get a funnel web or mouse spider bite, which you need to check on circulation first, because as you know in first aid, breathing takes precedence over all other injuries. So we need to check there whether the person is breathing properly, and if not breathing normally or non-responsive, we need to go into CPR first. But if that's not the case, we certainly need to calm them down, call an ambulance, and we start applying a broad pressure bandage to the entire limb, and especially over the bite site. So it's probably best at times to do a slightly narrower bandage over the bite site itself, binding that quite firmly, and then starting at the extremity of the limb, bind it all the way up, and to splint the limb. So I mean, this is the one time we do worry about using splints at our level, and we splint the limb to keep it perfectly still. If you've got any questions on these areas, just scribble them down and we'll cover them towards the end. Covering there is the mosquito, particularly up around the riverina, the Murray River area. We need to be fairly wary of mosquito bites and take precautions. The lovely little darling at the bottom there, I don't know whether any of you have ever been bitten by a march fly, but they do not tickle. Being an organisation that takes our youth members and ourselves out into the bush quite a lot, we're more than likely to find some of these little darlings. the normal bull ant, European wasp, the jumping jack, sorry, the normal bull ant again, the jumping jack, which is that little black mongrel in the middle, paper wasp, and the insect that causes probably more troubles than an allergic reaction to peanuts, and that's the standard bee. So with mozzie bites, they can be quite itchy, and the risk people generally run is to try and scratch the wrist, and then the bite opens it up and infections. But mosquitoes can spread serious diseases, so in their case, it is probably better to err on the side of caution, and that is take protective measures. As a general rule, in my first aid kit, I can't recommend any particular brand, but in my first aid kit, I carry Bushman's insect repellent. It certainly works better than the one that comes in the blue can. I think it's Aerogard. But if you develop a rash, flu-like symptoms, chills, fevers, headaches, joint and muscle pains and swelling after mozzie bites, it could well be that you may have the beginnings of dengue fever or Ross River fever, particularly here in Victoria. Mozzie bites can be managed by washing the ear with soap and water, clean soap, and applying an antiseptic gel. Cold packs may help depending on whether the person has severe pain. And it's interesting in that area, actually, many Irish people, for some reason, develop quite a reaction to mozzie bites, with swelling, particularly around the bite area. But certainly in mosquito-prone areas, you should cover the skin as much as possible, use an insect repellent. And if you want further information, the Queensland Health website is quite a good one. Scorpion and centipede stings. Ice pack to the sting or bite site, clean the wound with antiseptic or wash with soap and water to help prevent secondary infection, and use a painkiller. Caterpillar stings. We're silly enough to handle caterpillars. Remove the visible caterpillar hairs with tweezers, and apply and remove sticky tape over the bite area to remove any finer caterpillar hairs, but don't scratch or rub the area, because that can make the hairs penetrate further and deeper into the skin. Bee stings, wasp stings and ant stings. Bees and wasp stings and Australian jumper or jumper jack ants are the most common triggers of anaphylaxis caused by insect stings. And we certainly have them all here. Wasps are generally more aggressive than bees and are attracted to food and sugary drinks. And again, on a preemptive move, certainly on camps, soft drinks in a can are completely banned altogether. If someone has to take a can of drink, or any drink at all, even if they make a cordial, pour it into a glass so they can see what they're drinking. Because wasps have got a lovely habit of getting inside cans of drink and going straight down into the throat, where they say, well, we can't get out of here, so it's a wallop, 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 and the poor person cops a few more bites. If you're stung by a bee, simply use a leaf, small piece of cardboard, credit card, whatever, to wipe the venom sac away from the person's skin. Don't try and grab hold of the end of it to pull it out, because you'll just be pumping more venom back into the skin. And having removed the sting, wash the affected area with soap and water and dry it gently. And if the pain hurts them too much, maybe an ice pack. And a little bit of apple cider vinegar if you've got. Wasps and bull ants rarely leave any sting in the skin, quite obviously. So use a cold pack soothing cream to relieve a minor reaction. Take oral antihistamines to treat the itch if necessary, and the person given the okay to do it. If the pain is persistent and continues, you should recommend them go off and see a doctor, as a doctor may recommend a cortisone tablets to settle down the swelling. A lot of this will depend on how badly people do react to insect bites of any description. In my case, for example, a bee can sting me, and I can hardly see where it's actually stung me. Certainly even with wasp stings and the others, they don't worry me in the slightest. But there are others who react very badly.
We've got a question. There's been a question, Tom.
Sorry?
Just before you keep going,
Yeah.
when you said soothing cream on the slide before, is that a specific cream? Because I had it suggested that toothpaste was okay.
Never heard of toothpaste being used, I'm not sure. It depends, it may well depend what's actually in the toothpaste. But that's one worth looking at, because it's something generally on a can. Somebody will have a toothpaste somewhere close by. Yeah, so it's one worth following up to see whether it does have any soothing effect. It may well be...
Placebo effect.
Sorry?
Placebo effect.
Yeah, well, no, it may be that depending on the brand of toothpaste, if it's got a, certainly if there's any mint flavour, in fact, which could be that the evaporative effect of that could cause some sort of soothing of the bite. Because certainly from wasps and bees, with some of them, and with our ants as well, it's the pain can be quite unbearable for some people. In fact, it can be almost nauseating, the pain from the variety of insect bites depending on the person. So anything we can do to take...
And the other question was, how do you know if someone's going into anaphylaxis with like a bee sting or something?
I should have put some, actually, or maybe I should have put some slides up on anaphylaxis. They'll show the standard reaction to anaphylaxis, or the anaphylactic reaction, in terms of their eyes, their mouths are swelling, whether or not they're starting to sound a bit raspy, having difficulty to breathe. And a lot of the time it will depend on how much of a reaction they do take. As I say, in my case, I have no reaction whatsoever to a bee, none at all. But for some people, it may be almost instantaneous, so it will depend. But for future, it may well be doing a probably more comprehensive series of slides on what anaphylaxis does actually look like. But this dear little creature here, those of us who go camping, and particularly in forested areas that are fairly damp, can probably never say that they've ever had any leeches on them. The usual treatment to remove a leech is with salt, or light a match, blow it straight out, and use the hot tip end on the leech himself to make him drop away. Or maybe heat a spoon or touch the back of the spoon to the leech. Don't try and pull it off, because he may well have embedded his spines into the flesh. But having removed the leech, here I'd throw out a question at people as to what's one of probably the better risks of having a leech on you in terms of future complications. So we might cover that later when we can get on asking questions, Erica. But certainly when we remove the leech, we need to clean it and cover it, because basically it's an open wound. And again, in all of these things, depending on the age of the person, depending on their reaction to these, I think we need to continually monitor their general behaviour and breathing. This one in particular is fairly apt considering the season we're coming into. They're on, maybe if people can respond to you by the chat line, Erica, if they're starting to the top line on the left-hand corner, name, and then work their way across the top line, and then the bottom lines, if they're able to recognise and name those snakes.
We've had a question for Eastern Brown.
Yeah.
Um,
This one here is the little darling, yeah, the deadliest snake in the world, the claim. And the question regarding the Eastern Brown is?
it was just a suggestion as to which one was the Eastern Brown.
Ah, right, I'm retreating a bit, yeah. The one on the right is actually the Eastern Brown. Called the Eastern Brown because it's generally found in the eastern regions, particularly of New South Wales and in Victoria, but it likes dry, sandy country. Actually, we'll go through them. This one here is the dear old brown. That one there is the tiger snake. The one on the bottom left is the red belly black, and these two are snakes. Rarely seen down in this neck of the woods, but certainly if you ever get up to Queensland for a holiday, you'll certainly find some up there. But in general, in Australia, every snake is deadly in terms of treatment. We regard all snakes as deadly and we treat accordingly. Snake line shown on the right-hand side, but as you well know, that could be just one puncture, it could be 3, it could be 4, depending on whether the snake decides to have a couple of goes back at you. If he doesn't get to insert his fangs, but merely scrapes across the skin and opens up with a slight scratch, because of the configuration of Australian snake fangs, as you can see down that line there, that groove is on the outside of the snake fang. So if he merely scratches the skin, he can still inject venom into you through the open wound of a scratch, and the venom just running down the outside. Now, in terms of treatment for a snake bite, funnel web, blue-ringed octopus, cone shell, we use the same method, and that's the pressure immobilisation technique. The bandage around the bite site, quite firm bandage around there, and the recommendation is that you should not be able to slide your finger in between the bandage and the skin. We then move to step 2, commence binding at the toes, leaving the tip of the toes exposed so we can check for the circulation. And we work all our way up the body as far as we can possibly go, using a broad bandage. And that style of bandage needs to be fairly firm, elasticized bandage, a broad one, and considering on the size of the person, you may need 1 or 2 of those. You actually can get them in 6 metre lengths, but they're worth having. Go back. So certainly with snake bite, funnel-web spider bite, mouse spider bite, the cone shell, blue-ringed octopus, it's necessary to keep the patient perfectly still. And the old rule applies, is that we bring the doctor to them, we don't take them to the doctor unless it's no other means of doing it. And the splitting of the limb itself is to prevent
You there, Tom? Huh. But this is his favorite. Oh, he's gone. Do you want to rejoin, Tom? Do you want to send me the PowerPoint and I'll keep going? Oh, okay, fair enough. We'll have to postpone for a couple of weeks.